Our talk today will be by Dr. Rashed Saleem, who is our pediatric neurologist in Al Ain, the Heart Medical Center / KidsHeart. Dr. Rashed just joined us recently from UK. However, he's not new in the region. He spent many years in UAE before, and he was working in an American Center for Psychiatry and Neurology. And finally, we were able to convince him to come back from UK to come back to the region. So Dr. Rashed is an expert in pediatric neurology, and he has worked for so many years. I can't even count it. Not that he's so old, but he's just very knowledgeable person. And we are very lucky and very happy to have him to be part of patient care at the Heart Medical Center, as well as the patient hall in UAE. Dr. Rashed, the microphone is yours.
Thank you very much, Dr. Muhammad Suleiman, for a very elaborate and nice introduction. Assalamu alaikum and good afternoon to everyone. Before I embark on discussing this topic, which is actually very important, and all of us must have come across it either in our personal lives vis-a-vis our children or professionally also. Just to highlight that the resources which I had tapped for the content of this presentation include American Academy of Pediatrics guidelines and CDC, which is actually Centers of Disease Control and Prevention, and a very comprehensive document prepared by Ministry of Education Abu Dhabi in collaboration with the UNICEF under the auspices of Association of Women and Childhood Abu Dhabi. So without wasting anybody's time, we'll quickly now start the topic. Okay, this outline might look quite long, but actually each of the subheadings has 1 or 2 slides, so it's not very long, don't worry about it. I'll start with the definition of bullying. Okay, so it's a form of youth violence. Now, youth violence has other components also, but this is one of them, and it is one of the adverse childhood experiences children can experience. Smith and Sharp defined it as a systematic abuse of power, whereas CDC defines it as repetitive or likely to be repetitive unwanted aggressive behavior perpetrated by youth or a group of youth against other youth who are not siblings. And this is likely to have implications in psychological, physical, social, and academic domains. And in a bullying setting, peers can be either a bully or a victim, or they can be bystanders. We'll talk about them. Now, looking at how big the problem is, just look at that 1 in every 5 children. This is a CDC result, but it happens everywhere across the globe. And 1 in 5, which is 20% of the high school children, will be bullied. And similarly, cyberbullying can be seen in 1 in 6, which is actually around 16.6%. Now, this one figure I would want to quote, Adverse Childhood Experience Study, which interviewed about 17,000 adults, not showing in the slide. They asked them about the adverse childhood experiences. 2/3 of them replied that they had at least experienced once in their life, and 20% of them reported about 3 adverse childhood experiences. And interestingly, it was seen that those who have experienced 6 adverse childhood experiences, their life expectancy can be cut down by 20 years. Okay, so it can have significant implications. Now, looking at the elements typically found in bullying, the first thing you have to find is that there is a power imbalance between a bully and a victim. This is very important. And second is there is an unjust use of power. And third is there is a desire to hurt the victim, and it is followed by a hurtful action. Once the action has happened, it is either it does happen or it is likely to be repeated. And the bully feels that he's dominant, and he feels very jubilant after perpetrating that bullying element. And the victim feels that he feels terrified, he feels that he is vulnerable, and so it's very important to find all these elements before we say that this is bullying or not. And now different types of bullying are there. Bullying include verbal abuse, gestural abuse, physical means, and relational bullying. I'll go into details of each because it is very important to recognize it. Now, verbal abuse can be verbal insults, it can be unfair criticism, it can be name calling. And one thing which is not mentioned actually in this list is body shaming. Body shaming, commenting on somebody's height, somebody's weight, somebody's looks, somebody's ears, somebody's nose, and all that. So body shaming is a very, very important part of verbal bullying. And this can be face-to-face in one's presence, or it can be through digital or electronic means, or through telephones, emails, and or web or social media communications. Then there is the gestural abuse. Gestural abuse can be showing threatening gestures, showing obscene gestures, and it can also include menacing stares, like looking at somebody staring with in a scaring manner. And it's very important that deliberately turning away from somebody, not giving attention to. All these are subtle forms of verbal bullying. Now, one conceptual myth is there: is every form of teasing a bullying? Actually, it is not. Any milder teasing where intention is not to hurt, and even the person who has been passed that comment, he enjoys that, that is actually not bullying. Similarly, fighting between two equals, power-wise who are equal, that is not bullying, that is fighting. Okay, and as I mentioned in the beginning, that bullying is a form of youth violence. So there are other forms of violence, fighting, actually firing injury, firearm injuries, and even homicides. They also are classified under that. But what we are talking about here is the bullying. So where requirement is having an imbalance of power. Okay, then physical means hitting others, throwing objects on others, and or even using a weapon for that matter, or removing and hiding some of the victim's belongings. And last but not the least, here is forming coalitions or gangs against a vulnerable victim. Now, these are actually from that collaborative document between UNICEF and Ministry of Education, just to give a pictorial representation of various forms of bullying. Now, bullying cycle is very important. Now, bullying cycle starts with the bully having a feeling that he is dominant, he is strong, and there is a isolated, vulnerable, weak victim. So this starts with that perception of the bully, and once that perception is there, there may be approvers of that that perception, which can be friends or part of that gang of bullies, and then they plan to hurt, undermine, or humiliate that person. And finally, this is followed by a action which can be verbal, social, physical, as you mentioned above. So the first time it starts with that perception of the bully, and then once it has happened, there are two possibilities. The victim can be a passive victim, and okay, so having bullied that vulnerable victim, bully has now a sense of dominance and superiority. This leads to actually suppression of his empathy, and this leads to continuation or perpetration of bullying, which can follow multiple times. And it's very important that if you see on the left of the slide, that there are approvers, which can be bystanders who approve this, and this is what actually encourages bully to perpetrate bullying again. So next, a bully may not always be lucky to find a passive victim. He can have a resistant victim who does not give in, and who can resist. And this is again important. What are the different ways a victim can respond and not give in? So he can distract, for example, distracting bully to some alternative activities of attention, like a sport or some other activity. He can seek help from teachers. He can act cool. This is very important. I'll discuss in one of the slides the technique of fogging. So fogging is a technique of response to bullies. So he can seek help, he can act cool as if he is not affected, and he can actually fight back, or he can run away. So in such situations, bully might review his situation, reappraise that, and he might either desist from bullying again, so bullying can stop, or he can continue bullying unabated, or he can devise different ways. So it depends upon how the victim responds. Now, this might, so, apologies for this busy slide, but this is a very, very important slide. There are two slides. One is risk factors, the other is protective factors. We will do one because the other is the opposite of that. Now, risk factors are not only in the individuals, and now the risk factors, these risk factors are risk factors in a bully. Okay, so individual bullies. So factors are not only in the individual, it is in the families and peer, they are also in the community, and they're also in the society. So it's a multifactorial in origin. Bullying does not arise overnight. It takes years. It takes to a bully mindset, and there are factors which are not only in the individual, they're in the family, they are in the peers, community. And so I'll just go through one by one because these are important. So in the individual, under educational achievement can be a risk factor. Then lack of non-violent problem solving. This is very important. It will be important in the family context also, that you resort to problem solving in a violent manner. If the families indulge in that, they will lead to the development of this behavioral trait in the child who will end up as a bully. So it's very important if we track back the roots of bullying into the families. I'll talk about that also. So problem solving should be non-violent, but if it is not, then it's a risk factor. Poor impulse control, poor anger management skills, witnessing violence in the family, like growing up witnessing violence among parents or siblings, or witnessing violence on media, and even PlayStation games and video games which have violence, that can also predispose to developing such a phenotype, which is a bully phenotype. And presence of psychological mental health problems can be an important risk factor, and substance abuse. Now, family, very, very important. I think this side of bullying is generally overlooked. Now, the families which are unstable, what I mean is functionally unstable, and they resort to violent means for problem solving, including actually physical violence. And this is all observed by children when they're growing up. So this can be a very high, very big risk factors. And it's very important that families use authoritative rather than authoritarian approach to parenting. And what does that mean? Authoritarian approach of parenting is basically that use of discipline with force and with a callous heart. Whereas authoritative approach of parenting is that you enforce discipline with warmth. So you set boundaries, behavioral boundaries, but you do not use violent force. This is very important. So authoritative parenting is recommended, whereas authoritarian parenting is recommended against. Very important. Now, another thing which I think all of us face is peers. Now, associating with delinquent peers, when children are teenagers, they love to experiment and explore. When they start telling parents that we are no more children and you are old people, your thoughts are outdated and obsolete, and then they start experimenting. And then they start going out with delinquent peers. They start trying smoking and other things also. And they can also start fighting, like they are now experiencing manhood kind of thing. So they start experimenting there, and gang involvement. Now, community, I'll just mention a couple of things. Now, difference between a community and society is community is a smaller group confined to a particular geographic entity and sharing some common traits. A school can be a community. We can have a rural community. We can have a suburban community. So community is smaller, or we call them neighborhood in US terms. But society is a larger, which is a group of actually communities. So there are more common cultural things there. But when it comes to societies, it is basically their norms, policies, and cultural norms and rules. When it comes to community, the risk factor will be, for example, no cohesion, social cohesion between the community. And then there can be social and economic disparities or presence of violence in the community. One factor from the society I want to mention is very, very important, is that societal cultural norms which discriminate between gender, masculine and feminine, that can actually underlying as a risk factor which can lead to bullying. Okay, I will rush through it because this is the reverse of that, protective factors. If the other things are there, opposite of that, that is protective. Consequences, very, very important. Consequences of bullying can be injury, physical injury, other physical problems like sleep disturbances, headaches, appetite changes, other medical problems. Mental health issues, very, very important. Low self-esteem, anxiety, post-traumatic stress disorder, depression, self-harm, suicide. So these are all very important mental health side. Academically, they can underachieve or they can drop out of schools. Social isolation, marginalization, very important. At the time of employment, you can have issues, and even marriage failures in future can result. And this also applies to bullies. Bullies have a very long-term poor outcome in employment. They fall out at employment places. They have a very high prevalence of marriage failures because their phenotype has developed over the years, and that is inculcated in their minds, behaviors. So it's very important. Now, how can we prevent bullying? Now, this was actually the basic topic. So as I told you, bullying is a multifactorial in origin. So if you want to address it, you need to have a multi-agency, multidisciplinary approach also. This is just one slide. I'll take like a minute or so on every topic I've highlighted. No, as in many other medical issues, prevention can be primary or secondary. Starting with primary prevention, this starts very early in the child, after the birth of the child actually, because family has to start doing caregiver practices which are safe, so that means a lot of we need to look into that side of our lives, very, very important, but commonly overlooked. So quality education, what is quality education? Quality education in early life. So any schools where the children are sent to in early life, they should, in addition to their academics, they should focus on children's their cognitive development, their social skill development, and inculcating a good youth skill, which I'll talk about in the next topic, which is the youth skills. So in youth skills, very, very important is, do the children have good communication skills? Do they have good non-violent conflict resolution skills? Do they have anger management skills? Do they have good empathy to others? So all these skills are very, very important. And if these cannot be imported from outside, these cannot be just taught by schools. These will start from home. And who will be doing it? Parents. Parents have to be role models. If parents are fighting, conflicting, shouting, and hitting each other, they cannot inculcate good, empathetic, anger management, non-violent, conflict resolution, or anger management skills. Very, very important. So we have to look into our own lives first. Okay, supportive family environment is basically, as I mentioned earlier, an authoritative parenting, not authoritarian parenting. Parents should aim at stable social environment. Socially functional families, they yield favorable outcomes. Caring adults is connecting youth to the caring adults. How does it affect? You can have caring adults as teachers who can be, or coaches, or they can be maybe some community or family elderly figure who are a very good role model, who can mentor actually the youth. Very important. This can have a very salutary effect on the development of a young, because youth is the period when bullying occurs the most. In schools should form and implement anti-bullying policy. The document I was referring to, prepared by Education Ministry Abu Dhabi in collaboration with UNICEF, that's actually a very comprehensive document on training of teachers in handling bullying. So all schools should have, they should formulate and implement anti-bullying policy, and then schools they should train their staff to tackle bullying, which I was referring to that document. And finally, we also have a role if we come across children, although with reference to UK, US and other developed countries, there will be routine or regular health check visits, but probably this may not necessarily apply here, but we do come across children and the families, and whenever they report it, we should actually we should screen for risk factors. There is a tool which I've shared on my desktop, can be shared later, which is actually pediatric symptom check tool. So you can screen children for that and then provide anticipatory guidance. I have a couple of slides at the end, which is for anticipatory guidance provided by pediatric healthcare providers, which we are the pediatric healthcare provider. Secondary prevention is basically that once the bullying has happened, what should we do now? So a comprehensive tackling of the bullying itself is a very good secondary prevention. Second is putting safety and conflict avoiding strategies in place is important. Fogging technique, which I mentioned earlier, the fogging technique is that if somebody passes a comment about your nose, your head, your ear shape or body body habitat, how tall you are and all that. So instead of giving in or either reacting negatively, you can act cool. You can just say, okay, take it easy, or you can say that, okay, you have this opinion, it doesn't matter to me and all that kind of a thing, or you can just walk away. That is called fogging technique. Very important. It can be a secondary strategy used by the victims. Counseling about youth skills is very important. I mentioned about desirable youth skills are empathy, good communication skills, anger management skills, non-violent conflict resolution skills. All those are very important skills, and we should counsel them if they don't have, and this can be a secondary prevention also. Last is a risk stratification for further violence. There is a criteria for risk stratification, particularly in adolescents, where you can use their school attendance and performance, use of drugs or abuse of drugs, or if they fight. Based on that, you can divide it into mild, moderate, and severe, because that indicates a future risk of violence for those children. Okay, addressing bullying. Let me just take the time. Okay. Addressing bullying is important. So bullying addressing is also a multifactorial response. It can be teachers, it can be parents, it can be victim, it can be professional also. Quickly, teachers use direct sanctions, restorative practice. These are the methods. Mediation, support group methods, shared group method. But I'll just mention a few things about the first one. Corporal punishment, which is a physical beating, it is now prohibited in many countries, including UAE. But direct sanctions can include verbal reprimands. They can you can tell the bully that will see your parents and see them. Temporary removal from the class. It can be withdrawal of privileges. It can be school community service. It can be detention or internal exclusion, or a child can or a pupil can be excluded from school in short term and long term. So these are the various direct strategies. But most important one is that no corporal punishment. Okay. Next, this is a victim strategy. The victim can ignore. Victim can walk away. Victim can talk friendly. Victim can talk firmly, or victim can like run away, escape. Okay, these are all strategies which is a part of actually fogging technique, which I mentioned. Now, parents of the bully, they should not defend their son or whosoever is perpetrating. They should investigate the problem. If they find that son is responsible, or for that matter, their child is responsible for bullying, they should make it very clear: zero tolerance for bullying. They should not defend bullies. Okay, parents of the victim should support their child. I don't know about West, but in a recent practice is that if your child has come home crying, the mother will start beating him. You are so weak, you did not defend yourself. That should not be the case. We should be supportive to them. We should involve school. We should take school on board. We should ask them to institute a systematic investigation and then evolve a strategy to avoid conflict, to provide conflict resolution and secondary prevention. Now, as professionals, healthcare providers or pediatric care providers, we have a responsibility that we should screen these children. We should have a risk assessment and then risk stratification, which I mentioned above. We can refer our children to psychology for assessment or psychotherapeutic interventions. They might need counseling about post-traumatic stress behaviors or also youth skills. And similarly, a bully can be referred to psychologists to counsel them about youth skills which are favorable, which we have spoken about. A psychiatrist, if any of them has mental health issues, they can be referred to. Okay, so now pediatric care providers' role is the same, which I have mentioned above. This is providing information about preventive strategies, number one. Number two, screening them for any risk factors. Number three, risk stratification. Although I have slide, but I'll not go into those details. This will be a repetition of that. Okay, but if you want to have a look, you can look at my presentation, which we can share at the end. Okay, so now these are basically anticipatory guidance is providing information about early safe parenting practices. Okay, we can talk about to parents when they come with younger children. We have to talk about parents. They need to adopt those practices, which are actually above here. And then we tell them that you can put age-appropriate expectations and behavioral boundaries in place, but no use of physical means. So it should be non-violent parenting. Very, very important. Hitting and spanking cannot be justified. Okay. If you want to use, you can use timeout options. You can use token economy approaches of behavior. You can encourage positive behaviors by positive reinforcement, or you can discourage those by negative or logical or natural consequences, but not by hitting, beating, or those kind of things. Even the approach of saying that doctor will give you 2 injections and that is not a desirable practice. That should be discouraged also. Okay, so take-home messages are educational underachievement, witnessing violence, unstable family dynamics, community violence, societal norms which support aggression are some of the common risk factors. One thing which I have not put in is again re-emphasizing desirable youth skills include good communication skills, non-violent problem-solving skills or conflict resolution skills, empathy towards others, and connecting with others, and even resorting to mentoring by dependable people. Bullying, like other forms of youth and peer violence, is a multifactorial in origin, and as a result, preventing and addressing bullying warrants a multi-agency and multidisciplinary approach. Thank you very much. References and my acknowledgement here. Any questions? I'm happy to answer those.
Thank you, Dr. Rashed. Really, it was very much something that I want to learn for a long time, as my education was all about cardiology. Now I'm learning something very nice and very important for all of us, as we all have kids and we all, are parents, and our kids either exposed or even suffer from this kind of problems. But let me ask the people who's around me right now. Anybody have a question, Doctor? You're fine. Do you, Dr. Sharif? You are fine? Psychology? All right. So my question to you, Dr. Rashed, for bullying, there is, from what you mentioned, there is some extreme measure as complete exclusion as an example. That's an extreme things, right? But
so message in that option is basically that we should preferably avoid extreme punishment, including corporal punishment. But this is because this content, as I told you, I have taken from the resources which are referenced already. But let me share with you, even before I was coming from UK, from Alderhay, Liverpool this time, one of my patients who actually had a young patient with idiopathic intracranial hypertension, he had a genuine reason to attend hospitals, and he was excluded from school. So even now, I mean, in places like UK, extremes are still practiced. But I agree with you. The crux of this presentation message is that we should avoid extreme methods and strategies to handle our children. To be honest, I mean, a lot of households, even here, including all of ourselves, we have not been practicing a very kind of non-violent ways of parenting and all that. This is what I wanted to convey. It's not only the child, it's not only the bully. Bully was not, it was not formed in one day, overnight. He learned all these behavioral traits over years by observing parents, families around, community, society, seeing, watching violence on through movies. Even these youth which play these video games and all that, there's a lot of violence there. So all that actually has a cumulative effect. I mean, one of the topics which I read although I didn't mention it, is a toxic stress. Toxic stress actually is a cumulative response to all these childhood adverse experiences, which can actually lead to structural changes and basic changes in the brain itself, and finally becoming an epigenetic phenomena to even change the genetic expression. So, I mean, basically, this is a societal, this is a manifestation of a societal malaise. I mean, this is a societal, family, and community malaise, which is reflecting into that through that bullying. So we should take responsibility for that.
Another thing, I believe in the community overall. There is some people who are more susceptible or more prone to be bullied. such as like a fat child or people with special need, or this kind of autistic children. And how do we protect these people? How do we apply the protection? Because I can tell you, if I am fat and I am an adult and I'm walking, I'm going to be bullied by someone around me, as an example. And imagine you are in school while everybody, making fun of you.
Okay, so again, as I mentioned, I think even the schools, when they ask you to do such presentation, basically they want everyone to know that it is not one person's problem or a teacher is responsible. It is a societal problem, community problem, family problem. Okay, now you are right. So those who are at high risk, very high risk, as you said, children with special needs and all that, they are the ones who need to be provided additional supervision and adult supervision and support. And that is where the role of school will also be very important, that they should have some vigilance and monitoring mechanism. Actually, one of the things which is a part of that anticipatory guidance is that do parents have a supervisory monitoring mechanism? Similarly, in schools, there should be even like CCTVs and all those things being in place, so that all those who are vulnerable, they cannot defend themselves. So that is where the society will play their role, and that society includes the teacher and the parents of the bullies, parents of we as actually pediatricians, we are also advocates of children. So professionals can play a role, very important. Although I have put that pediatric care providers at the end, just because it was a repetition, but we have a role, both in looking at that risk factors, then assessing the risk, and then recommending school, for example, that this child needs additional support also, additional supervision also, and then society has to play a role. We all have to play our roles. We cannot just blame teachers. We cannot just blame the bully. And actually, bully's condition is a pitiable, because in the longer run, he is the one who's going to suffer. He is going to fail in marriage. He's going to fail in employment. He is the one who will suffer in the longer run. So again, it's not one person. It's a vigilance monitoring mechanism should be in place, which can be technology, which can be people, and the people should be very sensitive to the reported concerns. We should not overlook when even a child comes back home and reports something. I'll tell you one of the responses my son-in-law has given to his son, that if somebody does anything to you, hit him back. So that's not the right. So what we have to do is we have to do it in a way which is non-violent manner. We should not take it lightly. We should not overlook it. If somebody happens, meet the teachers, take them on board, ask them that they should not be repeated, and bullies should be. As I didn't go into details of those 5 strategies, which is one is that direct sanction, second is restorative approach, then there's the group method, then there's the mediation. They have a combination of coercive techniques and collaborative techniques. They are not always successful, but they are the ones employed by school. But I'm sure school alone cannot help it. They will fail until we contribute to it.
Okay, thank you. My last comment. Can you send us these guidelines that that you mentioned, that we can share it with the other healthcare professional and some schools as well? And the other thing, just because you mentioned the CCTV, I have heard it many times. The best place to bully without getting any consequences is in the school bathroom. So so is that, it's very disappointing. It go for everywhere to follow the victim.
See, I am using my face recognition for my mobile. So I am accessible to all investigation industry agencies all over the world, because they can access us from everywhere. So now we are, this video monitoring is the way to go, technology. And wherever it is possible, of course, excluding the private press and all that, it should be used, because now artificial intelligence technology and they have replaced human beings. So I think we have to be more innovative now to achieve our ends. As far as that guidelines for training of teachers by Ministry of Education, And UNICEF is a very comprehensive document. If you have alluded to that, I can share that, or you're asking about this presentation.
No, just please share that guidelines, it on WhatsApp as a PDF or something, and we'll send it either by email to all our network, or we will share it in the WhatsApp group where everybody can benefit from to see what the school is seeing.
Yeah, it's primarily for
the last thing we I just like to thank all the participants. We have 46 people who's attending on Zoom, and that's a very nice number. And there is no further question, and I think we are okay with that. We can go.
Thank you very much. Thank you.
Thank you, Dr. Rashed. Thank you.
Thank you very much. Cheers.
Thank you.